Okay, we are recording and we are live on YouTube. So I think we're going to go ahead and get started if that's okay.
Let's do it.
I am hearing an echo. Is anybody else?
I don't hear it.
Okay. All right. Good afternoon. My name is Laura Peel, and sorry, I have the wrong script with that little mess up. Apologize. Okay, hello, I'm Laura Peel, JWB Director of Information Technology and your technology moderator. Board members, I want to take roll call and verify that your audio communication is working. And with that, when I call your name, please state that you can hear me. Susan Ralston.
Yes, I can hear you.
Mike McCurrick.
Yes, I can hear you.
Thank you. Rick Butler.
Yes, I can hear you.
Brian Ongst.
Yes, ma'am.
Bob Dillinger.
I can hear you.
Bernie McCabe.
Loud and clear.
Dr. Grego. No, don't see him on. Chief Milliken.
I can hear you.
Judge Moore.
I can hear you.
Okay. And Karen Seal.
I can hear you too. Thank
Okay,
you.
thank you. I'm sorry, I'm getting a terrible echo, so I'm going to work on that. I'm going to hand it over to Beth now.
Okay, and Dr. Grego was caught in a meeting and will be late, but we'll make every attempt to make the trim hearing. So, good afternoon. This regular Finance Committee meeting, then board meeting of the Juvenile Welfare Board of Pinellas County is being conducted remotely, consistent with Florida Governor DeSantis's Executive Order 20-69 of March 20th, 2020, due to the current state of emergency throughout the state of Florida, given the outbreak of the novel coronavirus COVID-19. In order to mitigate the transmission of the virus and reduce risk of COVID-19 illness, we have been advised and directed by the state to suspend public gatherings, and as such, the Governor's Order EO 20-69 suspends the requirement of the Sunshine Law to have all meetings in a specific public place and to require a quorum to be present in person. And EO 20-69 has been extended by EO 20-193. These executive orders posted on JWB's public notices website allows public bodies to utilize communications media technology to conduct its business. For this meeting, JWB is convening via Zoom webinar and telephone conference posted on our website, which clarifies how the public may join and participate. A public meeting notice was published in the Tampa Bay Times on September 6, 2020, as required by Section 189.015 of Florida statutes. Please note that this meeting is being recorded on Zoom webinar and YouTube Live. Also, some attendees are participating by telephone conference. Participants are advised that people may be listening who do not provide comment, and those persons are not required to identify themselves. Accordingly, please be aware that others may be able to see you. Anything that you broadcast may be captured by the recording and will become part of the public record of the Juvenile Welfare Board of Pinellas County. Laura Peel, JWB Director of Information Technology, will serve as the technology moderator of the remote participation by JWB board members, JWB staff, presenters, and the public.
With that, I guess I'll call the Finance Committee meeting to order.
Let's see, we've got some more script to do. Laura?
Yes, I apologize.
Sorry.
I was having a terrible echo and I think it's finally gone. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Staff, when I call your name, please respond in the affirmative. Beth Houghton. We have
Yes.
four yes.
Yes.
Okay. Judith Warren,
Yes.
Laura Brock,
Yes.
Linda Leedy,
Yes.
Millicent Battle. Millicent, could you hear me?
Yes.
Okay, thank you. Yuritas Garcia,
Yes, I can hear you.
Michael Havelka,
Yep, I can hear you.
Karen Bogus,
Yes, I can hear you.
and April Putsulu.
Confirm, yes.
And we have a couple more, Laurie Lewis,
Yes.
Diana Caro,
Yes.
Lynn Delator.
Yes.
Thank you. Please mute your device until you're called on to speak.
All of the materials for this meeting are posted on JWB's website with the agenda for the meeting, and we recommend that JWB's board members and the public follow the agenda as posted until we note, unless we note otherwise. Now turning to the agenda, but before we do that, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. The chair will introduce each item on the agenda. After staff has presented the item, the chair will entertain questions by board members. Please physically raise your hand in Zoom webinar to be recognized. If you're on a telephone conference line, please press *9 so the moderator may unmute your line. We will have public comment before the vote on each action item and during the open agenda. Please use the raise hand feature in Zoom webinar or press *9 if you are on a telephone conference line to be recognized to speak. The moderator will call on each person by name or the last 4 digits of the call-in number, allowing 3 minutes for comments. Each vote will be taken as a roll call vote. Further, for all participants, board members, staff, and the public, please remember to mute your phone or device when you're not speaking. And please remember to speak clearly and in a way that helps generate accurate minutes. With that, I will first turn the meeting over to Mr. McCabe, Finance Committee Chair, to handle the Finance Committee, and then to Mrs. Ralston, JWB Board Chair, to commence with our regular JWB Board meeting.
I note that we have a quorum for the Finance Committee meeting. The only item on the agenda is approval of the minutes of our last meeting. Is there a motion to, and which have been provided to all members of the committee and probably the members of the board?
So moved.
So moved.
Second.
Second. All right, all in favor, say aye. Aye.
Aye.
Opposed, same sign. Okay, any other business for the Finance Committee? Hearing none, we are adjourned.
Okay, then, we're ready to call to order our Juvenile Welfare Board meeting of Tuesday, September 15th. And if you would, please, I'd like to call for a moment of silence in recognition of losing a community hero this week, Bill Heller. Bill was a man of substance, as you all know, I'm sure. He was an unbelievable advocate for USF St. Petersburg, a former state legislator, and a selfless leader for all in the community, so many organizations that he served. So if you join me in a moment of remembrance of Bill Heller.
Good man.
All right. He was a good friend to many of you, as I would assume. Good man. Let's go ahead and call for our motion to accept the consent agenda items as presented.
So move.
A second, please.
Second.
Laura, I'll turn it over to you for a roll call vote.
Okay. Well, Susan Ralston,
Yes.
Michael McCurrick,
Yes.
Rick Butler,
Yes.
Brian Ongst,
Yes.
Bob Dillinger. Bob? We can't hear you.
Yes. Yes.
Thank you. Bernie McCabe,
Yes,
Chief Milliken,
Yes.
Judge Moore,
Yes.
Karen Seal.
Yes.
Thank you.
All right, if you're following along on the agenda, we're item number 3, action items. We'll begin with the ratification of CEO approvals. Beth, would you like to make a brief presentation on this topic?
There is a memo in your packet. We have done this before, but this is to ratify approvals that I have made that are outside of my typical $50,000 limit. And you'll see the 2 items listed on the second page of that memo are 2 different budget or payment amounts to GA Foods for shelf-stable food, totaling $100,000.
Does this need a vote?
Yes,
I think at this moment, we'll go ahead and at least get the motion on the table. So can I have a motion and a second, and then we'll have some discussion.
I so move.
Thank you. And a second.
Second.
Thank you. Now, any conversation, any discussion, comments on this item before we go for a vote?
Well, I just don't know how many people were around, but we did a nationwide search for a food provider for JWB when we first started out. And I think when we first started, it was like for 250. And we had people from around the country apply, but GA Foods won, and they also gave us the ability to store food, which was a big deal with the quantities that we were talking about. So I think we have a very reliable provider. It also happens to be local, and it was unanimously approved by the board way back when.
agree. They continue to be a good partner.
Good. Laura, do we have any public comments requested for this topic?
I'm going to give it just a moment, but it doesn't look like it. No.
Any final comments from the board? Hearing none. Laura, would you proceed with the vote, please?
Yes, board members, when I call your name, please state your vote. Susan Ralston,
Yes.
Mike McCurrick,
Yes.
Rick Butler,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
Yes.
Chief Milliken,
Yes.
Judge Moore,
Yes.
Karen Seal.
Yes.
Thank you.
All right. Action items B, approving the 90-day extension to emergency response compensation period. Beth?
This has been a juvenile welfare board policy to continue to fund previously approved programs for a period of at least 60 days after Pinellas County Emergency Management is declared a disaster, provided that the program that we are funding agrees to comply with requests from JWB. And it also delegates authority to the CEO, to me, to approve contracts for emergency funding from our contingency budget to meet urgent needs, provided that I report that to you and seek ratification at the following JWB board meeting. Because we continue to be in a COVID environment, and this has been exceedingly helpful to sustain our organizations who've not all been able to operate fully. I would recommend that we extend this emergency response compensation period another 90 days, which would take us to December 14th, 2020.
Okay. Let's get a motion and a second on the floor before discussion. Do we have a motion to approve?
Motion to approve.
Second.
Second?
Yes, second.
Thank you. Any comments from board members? This is rote and routine that we've been doing since COVID. So at this point, I'll ask Laura if we have anybody from the public asking to comment on this topic.
And I'm giving it just a moment to see if anybody raises their hand, but does not appear we have any comments.
All right, would you like to proceed, please, with the roll call vote?
Sure. Board members, when I call your name, please state your vote. Susan Ralston,
Yes.
Mike McCurrick,
Yes.
Rick Butler,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
Yes.
Chief Milliken,
Yes.
Judge Moore,
yes,
Karen Seal.
Yes.
Thank you.
Okay, number 3C is to ratify the Finance Committee recommendations from the August 18th meeting. There are 3 recommendations. Laura Brock will handle each of them, but we will be voting on them individually. So Laura, the first one is to approve the Grants Management Cloud Solution Cooperative Purchase. Why don't you give us a reminder update on this?
Thank you. Yes, we're seeking approval for the Grant Management Cloud Solution Cooperative Purchase to SHI International Corporation. This is with an annual amount of $228,237 for fiscal year 21 and a total of $685,185 over a 5-year period. We've provided information relative to the selection process and our recommendation, and it's all been included in your memo. Would you like me to go through the other 2 items or just take a vote on this one?
No, we have to stop and take a vote on each one, and each one of these were totally vetted during our Finance Committee meeting. So let's go ahead and at least put a motion and a second on the table.
I motion to approve.
Thanks, Mike. Second, I heard Mr. Ongst. Any comments from the board members before we go for public comment? All right, Laura, do we have any public requests to speak to this item?
Keeping my eye open and I do not see any. No, I would say there's no comments.
Okay, would you proceed with the roll call vote, please?
Yes, board members, when I call your name, please state your vote. Susan Ralston,
Yes.
Mike McCurrick,
Yes.
Rick Butler,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
Yes.
Chief Milliken,
Yes.
Judge Moore,
yes,
Karen Seal.
Yes.
Thank you.
The second item is to approve release of capital request for applications on RFA. And Laura, once again, I'll turn it over to you.
Thank you. This is the 6th consecutive year that JWB is offering funding for non-operating and capital projects through this competitive process. Couple changes this year. The increase in total funds available for the award went from 1 million to 1.25 million. We also increased the maximum project request from 1 project to 2 projects per agency. And that total dollar amount was also increased collectively for the 2 projects from 100,000 to 125,000 in light of COVID, and in hopes that some of the agencies might want to get some capital items needed for next fiscal year. Chair Ralston.
Thank you. How about we get the motion and second on the floor, please? Do we have a motion for this item? Thank you.
Second.
I'll second it. Whoever did.
Thank you. Any comments from the board? Laura, do we have any public requests for comment?
I'm giving it just a moment, but it does not appear we do. No, I don't see any.
Okay. Would you like to proceed with the roll call vote, please?
Yes, I will. When I call your name, please state your vote. Susan Ralston,
Yes.
Mike McCurrick,
Yes.
Rick Butler,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
Yes.
Chief Milliken,
Yes.
Judge Moore,
yes,
Karen Seal.
Yes.
Thank you.
Okay. The third and final recommendation from the Finance Committee is to approve Pinellas County Business Technology Services Agreement. Laura?
Yes, the Finance Committee is seeking approval of this intergovernmental service agreement between the BTS of Pinellas County in the amount of $295,993. JWB has been very happy with the services provided by them over the many years. The purpose of the agreement is to consolidate annual amendments that have occurred over the past several years and to put in a 5-year agreement. I'll turn it back over to you.
Okay, do I have a motion and a second, please?
So move.
Thank you, Jim. A second?
Second.
Thank you, Judge. Any comments from the board?
Yeah, I think we need to renew the fact that Mr. McCabe and I are on the BTS board, and JWB members or JWB employees' spouse is also involved with BTS, and that from our perspective, there was no conflict of interest, even though I don't recall it coming up to be voted on at the last BTS board meeting.
No, I don't think it did, Bob. And we have no financial interest in it one way or the other.
Thank you. Do we have any requests for public comment, Laura?
I do not see any request for public comment.
Okay. Hearing no other comments from the board, we should proceed with a roll call vote on this.
Okay. Board members, when I say your name, please state your vote. Susan Ralston,
Yes.
Mike McCurrick,
Yes.
Rick Butler,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
Yes,
Chief Milliken,
Yes.
Judge Moore,
Yes.
and Karen Seal.
Yes.
Thank you.
Thank you. All right, on the action items, we're on D, which is to approve community council appointments. And I believe we have 2 staff members, each making a presentation. If I'm not mistaken, it's for the South County and the Mid County to each add a member. So Millicent Battle followed by Yaya, if that's the order.
Actually, I'm going to start. Good afternoon. My name is
Hi, Yaya.
Hi, good afternoon. How are you? Yadidis Garcia, Community Planning Manager and Community Liaison for the Mid-County Community Council. I'm here today to introduce to you a new member for the Mid-County Community Council, Aisha Claremont. Ms. Claremont has over 27 years of community involvement, of which 25 has been in a diversified educational career, from being a public school teacher in Massachusetts to a corporate educator. She's also a certified personal coach by the John Maxwell Leadership Team and the Institute of Coaching at Harvard University Medical School of Coaching. Ms. Claremont is a bilingual pastor, English and Spanish. She's also an entrepreneur and a proud wife. I'm a mother of three children attending Pinellas County schools. Ms. Claremont is also the president for Pinellas County LULAC, the League of United Latin American Citizens. And precisely today is the first date of the Hispanic Heritage Month. She's also the Largo High PTA's president, as well as an active member of the Educational and Poverty Committee of the League of Women Voters in Pinellas County. She's also the outreach specialist for Restrong. With that, I will turn it over to Millicent Battle, who is going to introduce to you the South County Community Council members. Thank you.
Madam Chair, fellow board members, my name is Millicent Battle, Community Planner and Liaison to South County Community Council. Our nominee is Ms. Daphne Yvette Lampley. Ms. Lampley has worked in the field of prevention for 29 years with Operation PAR. Her experience includes providing prevention services for youth and their families in school and community settings. Project director of a 5-year research funded by the National Institute on Drug Abuse and director of Live Free Substance Abuse Prevention Coalition of Pinellas County. Prior to Operation PAR, Ms. Lampley worked as the shelter director at Youth and Family Connections and teacher at Southside Parent Child Development Center. Ms. Lampley a certified prevention professional, earned a bachelor degree of science in psychology from the University of Florida and Master of Science in mental health counseling from Nova Southeastern University. Ms. Lampley was born and raised in South St. Petersburg, has 2 children, 19 and 14, and is a member of Zeta Phi Beta Sorority, Inc. Upon board approval of these appointments, there will be 41 community council members, 10 in North County, 17 in Mid County, and 14 in South County.
Thank you. 2 wonderful members we get to vote on today. So let's get a motion on the table and a second, please.
I move to approve.
Second.
Thank you. Any comments from the board?
I
Are
think we
are
have-
either of those folks on the line and want to address the board?
If they are on the line, I'm going to give them a moment to raise their hand.
Daphne is in the audience.
Okay, we do have one request,
Good.
and it is Asia Claremont. Asia, you should be able to speak.
Thank you very much for the opportunity to be representing Pinellas County in your board. So it's a privilege, and I thank you all for consideration. Thank you very much.
Thank you.
Thank you.
Thank you.
And Daphne Lampley would also like to speak. Daphne, you should be able to unmute yourself and go ahead and speak.
Hi, I'd like to thank you for this opportunity to get involved. St. Pete has been my home, and I look forward to working with Millicent and the South County Council over the next several years. So thank you for the opportunity.
Thank you.
Thank you.
Thank you.
We certainly welcome your community service on behalf of JWB, and we're grateful to have you. And at this moment, let's see if there's any other public comment. Laura?
Yeah, I'm giving it just another moment, but it does not appear there's any further public comment.
Good. Well, then let's proceed with the board vote and make these 2 wonderful women official.
Okay, board members, when I call your name, please state your vote. Susan Ralston,
Yes.
Mike McCurrick,
Yes.
Rick Butler,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
Yes.
Chief Milliken,
Yes.
Judge Moore,
Yes.
and Karen Seal.
Yes.
Thank you.
Welcome aboard. The next item E, I'd like to begin by reminding you that our current strategic plan ends September 30th of this year. It was very pleasing for the staff to begin as early as November through the month of March. At every board meeting that we had during those months, we had an update on the strategic plan. We had people come and speak to us to position us to begin work on our follow-up strategic plan. So November through March, we had 2 consultants working with us, and we were well on our way to put in the time, effort to begin the new strategic planning, to complete it, I should say, and get it approved. Well, we all know what happened in April. COVID closed us all down and diverted our attention to much more higher priority things in Pinellas County. But I did have conversations with Beth about doing everything we could, given our virtual meeting capabilities, to see if we could surface our work again on the strategic plan and to not lose any time so that we could possibly approve a new strategic plan, hopefully today, to get us ready to prepare for the future. So we went ahead, and thank you to the St. Petersburg College to do our epicenter virtual retreat. And we did that, and we had the staff present a revised strategic plan based on our thinking and based on our work at that virtual retreat. And you all have it in your packet. I'm assuming, if I heard correctly, Beth has spoken to all of us to make sure that every single board member had the opportunity to review the plan with her individually. So at this point, I will turn this over to Beth and see if we can hear the final stages of our strategic plan and see if we're prepared to vote on that. Beth?
As Chair Ralston said, you have had in your packet the more detailed strategic plan, and I will not go line item by line item through that. So I'm going to attempt to just hit what I think are the highlights or the things that are new or have changed or will be a heavy lift. But in the aggregate, I would reiterate Ms. Ralston's comment that what is in this plan is a reflection of what we have heard from you and the community through this entire last year, culminating in the time we had together via Zoom, but we had together with collaborative labs. So the mission, vision, and values that start out this document are largely unchanged, although we did find that there had been no changes made to those in a very long time. So we did look, and there's a little bit of wordsmithing to some of that. The notable addition is clear language within our values of our continuing value of commitment to equity, diversity and inclusion. So certainly that is nothing new, but we did not have a clear statement in our values to that effect, and that seemed more than appropriate. Overall, our goal areas continue from the last strategic plan with 2 additions. We broke out early childhood development, 0 to 3 years old, from the school readiness goal to further add emphasis to that. And we added goal number 6 to address the organizational capacity needed to meet our mission. There have always been internal goals relative to these topics, but we had not included them at the highest level in the strategic plan. So most of our specific strategies are continued from our current work, but I'll highlight notable additions to be implemented over this 5-year period, as well as continued efforts that are particularly significant or will be stepped up. The addition of the implementation of a cognitive, social, and emotional evaluation tool appropriate for each age group to link children to appropriate services has been added. And so you see that, I think, in at least three different ones of our goal areas. This really reflects the broadening of our focus into the social and emotional realms, which is consistent with this board's commitment to our Children's Mental Health Initiative. Under early childhood development, strategies 1.2 and 1.3 would include launching a campaign targeting parents and other caregivers to enhance their practical knowledge and implementation of best child development principles, and to engage parents and caregivers in this effort. And we heard from different, I think both Barbara Morrison-Rodriguez and Dr. Jamie Hale about the importance of these back in February or March. Under school success strategy 3.1 is to evaluate the current literacy services that had been expanded already and assess them for further expansion. And this is tied, of course, to strategy 3.3, in which we continue to take steps in the campaign for grade level reading. Strategy 3.5 is a commitment to continue the Children's Mental Health Initiative pilot, with pediatric offices providing screening to refer to appropriate services. And while we continue our very successful strategies that are part of our 4th goal, prevention of child abuse and neglect, as our board has noted, we need new strategies to engage more families who are not being touched by these programs. And so strategies 4.2, 4.3, and 4.7 are all different ways at aiming at or using new or revised strategies to identify and connect at-risk families before they're touched by the child welfare system. We're recommending recommitting to the Family Services Initiative to stabilize Pinellas families, including the prevention of homelessness through both linkage to community resources and funding for other basic needs. In our fifth goal, strengthening community, we're recommitting to our neighborhood family centers and adding strategies to strengthen the effectiveness of the family support services that are in each center. We are blessed with 3 strong community councils and the Youth Leadership Committee, all of whom enhance our work. Over the 5 years, we have added a strategy to employ a data-driven feedback tool to better inform the work of those councils. And probably later in the 5-year time frame, we will be developing our capacity to engage community members more as active partners in our shared mission. While enhancing organizational capacity, our last goal, has long been a strength of the Juvenile Welfare Board, we've added this as a specific named goal in our strategic plan. So the goal of organizational capacity includes strategies related to advocacy, cultural intelligence, staff development, data system capability, maintaining our COA accreditation, and serving as a hub for community efforts that strengthen the lives of children. I would say overall that this is an ambitious but a focused plan. Some strategies will begin in year 1, others not until later in the 5-year period. Executive staff is now working on prioritization of these, all of these efforts to assure that they follow sequentially in ways that make sense, build on our current strengths, and are mindful of reasonable expectations of our very amazing staff. So on behalf of our staff and consultants, I'm pleased to present the strategic plan to you for your approval as what we believe to be a reflection of your work and your direction. And of course, I welcome any questions.
Thank you, Beth. The staff has been Herculean in putting together this document under unusual circumstances, we'll say. I think the best course of action here is to put a motion and a second on the table and then open up for conversation and discussion. Do we have a motion?
I'll motion.
Thank you, Mike. And a second, Karen? With that, open up to board conversation, comments, and questions. Mike?
Yes, again, I agree with you. I'd like to thank the staff for all the hard work that they have done in trying to, during this tough time, putting this all together. What I'm also extremely pleased with is the goal number 1, and that's the early learning, early childhood development. That's something we've spoken about, we've talked about, we worked around it and done a little bit in it. And now it appears, and as it should be, is that we're really going to step headlong into it and make it a pure initiative that'll help provide value for 0 to 3 and other children as we proceed. So again, I'm really happy to see that we've made this step, and I look forward to working with the staff to build it out and share it into the community and hopefully help a lot of children.
Good. Comments, concerns, questions, clarification? All right. Well, like Mike, I am overjoyed at the ultimate prevention strategy is to get that 0 to 3 in there. And a very important initiative of mine is to start addressing the children that we're not serving, and how do we go out in the community and start reaching more and more children who aren't taking advantage of our funded programs. So I believe we've really covered a lot of ground with this strategic plan. And as Beth has said, we've added that extra 6th area of organizational capacity, which unfortunately we can't do any of that unless we keep up our data systems and, quite frankly, our staff development. So I'm overjoyed. We have a motion, we have a second. Hearing no further comments, concerns, questions, Let's see, Laura Peel, do we have any requests for public comment on this topic?
And I'm just giving it a moment to see if anyone raises their hand. And I do not see any public comment.
All right, well, this is very, very rewarding. Let's go ahead and call for a roll call vote on the strategic plan.
Okay, board members, when I call your name, please state your vote. Susan Ralston,
Yes,
Mike McCurrick,
Yes.
Rick Butler,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
Yes.
Chief Milliken,
Yes.
Judge Moore,
Yes.
and Karen Seal.
Yes.
Thank you.
motion carries. All right, we're on to item 4 on the agenda, which is the discussion of the summary of the changes to the fiscal year 21 budget. So Laura Brock, do you want to do the high level review on this?
Thank you. Yes. So I'm here today to provide an update and a summary to the changes to the fiscal year budget. On July 9th, 2020, the board approved a proposed millage rate of 0.8981 and a preliminary budget in the amount of $110,847,275. Since then, the staff presented the detailed budget updated to the Finance Committee at the August 18th meeting. And on August 24th, the property appraiser mailed out the trim notices to all property owners. As you're aware, we're holding the first trim hearing meeting immediately after this board meeting, and we'll be voting on the millage rate and the fiscal 21 preliminary budget. But I wanted to just highlight a few changes that have been made since the budget you've seen back in July. So the budget was originally proposed at 110 million, and with a few changes, they've changed because the change in the beginning fund balance from the prior year, when we use the budget, it's calculated based on our current and actual numbers, and those numbers have changed a little bit. So the beginning fund balance amount has increased from 31.9 million to 34.7 million. So it's about a $2.8 million increase. And then we had a budget neutral shift between salaries and contractual services. So now the proposed budget for fiscal 21 is $113,653,985. And you can see the summary sheets in the detail, providing all the information relative to that, but that's the high level change. And I'd be glad to answer any questions that anyone may have.
Is this an action item?
No, sir. It's discussion because we're going to a full vote at the trim hearing. So this is discussion regarding any last minute questions, comments, or concerns about the budget that we've seen pretty much frequently since June, right, Laura?
June 25th, I think.
Any other comments? All right, well, we'll be seeing it in more detail at the trim meeting following this meeting. So we're moving on to item 5 on this board agenda, presentations, assuming we'll have time for both. We're moving along pretty rapidly. So item A is the Children's Mental Health Initiative update. And Linda Leedy, I believe you're going to do that for us.
Yes, I am. Just a minute. Let me share my screen. Can everybody see that?
Yes, we can see it. Thanks.
Okay. My name is Linda Leedy, and I'm the Chief Administrative Officer here at JWB. And today I'm going to provide an update on our Children's Mental Health Initiative. This is just a reminder of all the partners that we have working closely with us to improve access to and coordination of mental health care for kids in Pinellas County. This is our 5-year timeline. You've seen this before. I just want to highlight what we've been focusing on in 2020. Education, educating on the behavioral health integrated model. educating pediatricians on medically managing low complexity conditions, and educating on the impact of trauma on both the physical and mental health of our young kids. We've come to consensus on the use of a universal screening tool for trauma, which is the ACE-Q. We've improved communication between providers with direct secure messaging. We've concluded our thematic analysis of the parent and caregiver focus groups that occurred in the fall, and we developed our first impact statement. This impact statement you should have all received via email in July, and it is designed for all stakeholders and community leaders like yourselves who are interested in the initiative at a quick glance to see the highlights, see our mission, and see where we're headed. I'm just going to highlight two quick numbers at the top here, and let me state specifically that when this was produced, this was from data from October 1st through March 31st, the first 6 months of this integrated model within the community health centers of Pinellas. And in the first 6 months, 5,480 kids were screened for adverse childhood experiences. Since we released this, we have now received the June numbers, and through June, so 9 months, 8,511 children have been screened by the community health centers for adverse childhood experiences. So that's a 3,000 child increase in just 3 months. And that's wholly attributable to the fact that the staff educator that's a part of this initiative developed training and then methodically pushed it out to all of the community health center staff at all locations. He did 2 separate trainings, one for the clinical staff and one for the non-clinical staff. So they have an understanding of the impact of trauma and the importance of the screening tool. The second number is that nearly 400 kids through March had a behavioral health appointment scheduled through this initiative at the community health centers. Through June, that number increased to 506 kids. 70% of those kids attended 1 or more sessions, which is a very high show rate for this particular population. So the last time I presented on this initiative was February. And then a little big pandemic dropped in our lap and caused, let's just say, some pivoting on all fronts. The community health centers of Pinellas became a community testing site. They had the pediatricians that are involved in this initiative, as well as every single one of their doctors at one point or another standing on the hot pavement in their parking lots, swabbing noses of Pinellas County residents that drove through in their cars. They also quickly shifted to telehealth, as did most of the providers in Pinellas County, for both physical and mental health, to minimize risk to all, as well as to reduce the foot traffic throughout their offices. For our part, JWB began hosting weekly calls with our behavioral health providers and asking primarily 2 things: checking in on how they were doing organizationally. Were they having any operational challenges that needed to be addressed? And then secondly, how were they operating with their staff? Were their staff coping? Were they still working? Were they able to work? And after a number of weeks, we discovered that a lot of them were beginning to struggle, particularly those serving the frontline staff, trying to deal with their own personal fears and challenges at home, and trying to school their kids, as well as meeting the needs of the families that they are serving. So we conducted a 3-month pilot for 3 of our funded agencies with reflective supervision, which is a training that teaches the supervisors how to better support their staff. And when the staff feel supported, then they're better able to deliver quality services to their clients, which are our kids and families. And the results from that pilot were very positive. Everybody felt it was very beneficial. So in the fall, I shared with you before that we did parent and caregiver focus groups. The team decided they also wanted to hear from the kids. What do kids feel about mental health? So the team developed a survey and pushed it out through all of anybody that has any touch to kids that they could reach them over the summer, which was difficult in this particular summer. The neighborhood family centers, anybody that we could be connected to, push these surveys out, and they could be completed either electronically or on paper. And we were happy to see that 217 kids actually did complete the survey. 90% of the respondents were ages 12 to 17 years. 64% lived in South County, 30% lived in Mid County, and 6% lived in North County. And we were pleased to learn that most kids in Pinellas County stated, of those responding, that they do have somebody to turn to, an adult that they can turn to in periods of strife or concern. We asked 3 separate questions about family, schools, and health professionals. And 92% of those responding said they had somebody in their family that they would feel comfortable going to if they felt that they were in a state of crisis. 76% said they had somebody at school, whether it's a teacher or a coach or a guidance counselor that they could talk to. And 57% would feel comfortable talking to their healthcare professional. There was one question that we asked both the parent caregiver focus groups as well as the youth on their survey. And that was, what comes to mind when you hear the term mental health? And then we took all those responses from the separate groups and put them into word clouds. And a word cloud is a visual display of responses, and those that get the highest number of responses are displayed with more prominence in the word cloud. So the adults, the parents and caregivers, this is what their word cloud looks like, which demonstrates that the word that was the response that we heard the most often was the word stigma, because that's the largest word on the screen. Interestingly, the youth, their biggest word is depression. And in fact, on the youth word cloud, the word stigma doesn't even appear. So there's you know, and national studies are documenting this, and we are hearing it from our providers that the youth do not feel as much stigma with seeking mental health services as their parents do. And it's a good reminder that anytime you do any communication or education or outreach, you need to really tailor it to your audience. So our Centralized Oversight Committee is really our nuts and bolts day-to-day operational committee. This is the group that meets weekly. It used to be physically at the Community Health Center's location at Johnny Ruth Clark, and now it's gone virtual. And it didn't meet every week because some of those pediatricians were in parking lots. But the work is still moving forward. If the pediatricians present the cases, the team, it's a multidisciplinary team from numerous organizations throughout the county, our partners, that identify resources, assign tasks to the staff, and then wrap the care around the family. And then a few weeks or even a month later, there's a feedback loop, they bring the case back so everybody knows whether our intervention was successful. And the cases really run the gamut from ADHD to some more severe cases, like the one I'm going to share with you right now. There's a 5-year-old girl who was removed from her home due to severe neglect. And she was placed with her siblings with a relative caregiver. In February, the relative caregiver brought the 5-year-old to see the pediatrician at the community health centers. And there were some things that caused the pediatrician to be somewhat concerned about the situation. The girl was 5 years and 11 months old, couldn't speak 10 words, and she wasn't in kindergarten. So the pediatrician immediately referred the family over to the team that's working on this initiative, the mental health team. And the nurse case manager and the patient care coordinator jumped into action, working with the parent caregiver. And they all agreed that their immediate course of action would be to get the child prepared for kindergarten. So they got the child's screen set up with fiddlers, and fiddlers conducted a developmental evaluation. And the evaluation was then shared with the pediatrician as well as Pinellas County Schools, which held a staffing and identified the need for an IEP, which was developed. And from that determined what accommodations this girl was going to need when she started kindergarten. In April, the girl was able to begin speech therapy. In June, she saw a neurologist because the pediatrician was concerned, had some concerns about autism. So there was a neurological evaluation. And then later this month, the child will have a neuropsychiatric evaluation. But I'm happy to report the girl started kindergarten with her accommodations. But for this initiative, that just wouldn't have happened. The next step for this family and the nurse case manager is really to get this family and child into some counseling. That's the next hurdle. They clearly had trauma, but they wanted to get into school, and then they'll tackle the next barrier. In addition to this just being a difficult case because of the scenario, it was more difficult because the parent caregiver had low health literacy, so didn't understand, well, most of us don't, but how to navigate the healthcare system. So they were really instrumental in getting her connected to the right places, explaining why you needed a referral, what the purpose of the referral was going to render, what you would do with the information when you received it, how to follow up, and also the importance of continuing to keep both the school and the pediatrician informed of next steps with this child's development. And if that wasn't enough, the parent caregiver's husband lost his job in the spring due to COVID. So to top it all off, they had substantial financial strain. And the caregiver was very thankful and expressed lots of gratitude to the community health center staff for really helping her navigate through this really difficult situation. Our Centralized Oversight Committee is also using data to make decisions. So now they know, they've done some reporting. Asthma is the most diagnosed condition of the 4 to 11-year-old population that is seen at the community health centers. ADHD is the most diagnosed behavioral health condition among this age group. And 41% of the 4 to 11-year-olds seen at community health centers are obese. And these three conditions can be co-occurring, and they frequently are. But now that we know this, we can begin developing a standardized protocol for treating kids with both ADHD and asthma. And the committee is also driving process improvement. They've adopted a 4-quadrant model to stratify risk to determine the appropriate level of care. And using this approach, they're developing workflows and modifying them as they find maybe they're not working, not only within the community health centers, but also with external partners. So for example, we did have a case presentation of a child with asthma, and the pediatrician was presenting that they developed a care plan with this child. And then the school representative said, oh, well, the schools do a care plan for asthma as well. Well, not everybody knew that each other was doing a care plan on the same condition. And in some cases, they may have contradicted. So now they're developing a workflow to make sure that communication happens and everybody is, the plans align, or maybe they're even the same plan. Technology and information exchange. One of the most important things we're doing here is connecting patients to care and connecting providers to the patients and to each other. Community health centers has been able to use direct secure messaging they've secured it with Sunco Center, with Operation PAR, and they're actively working with Johns Hopkins All Children's, PEMS, and Directions for Living. And they're now able to securely send referrals and the continuity of care documents, so that if the patient is sent over to Suncoast can provide the treatment, community health centers can see what treatment was rendered, all in a secure fashion. Moving forward, the community health centers is implementing a more sophisticated telehealth system and communication system, which will allow them to share securely lab results, safety plans, screenings, and assessments. So what next? Well, so you see this guy over here with this tangle of cables. That's how we see our initiative. There's a lot of cables to be connected, a lot of inputs to plug in, but we are making them one by one. We feel like we've had a lot of successes, but there's still a lot more to connect, a lot more to do. So in the next 6 months, the teams are going to be refining their work plans based on all the information that we've learned in the last 6 months. The community health centers at Pinellas is going to begin to refine their workflows to make them a little more automatic and to improve communications and information sharing. And we anticipate at least, if not one, if not more, additional pediatric practice outside of the community health centers to be added to this initiative. So we're beginning to expand into the community. The guy in the tangle of the cords that you just saw, we think of him as our day-to-day operational work. but we continue to take the long view where there's a smooth road in our future that connects kids to care and enhances coordination and treatment. So with that, I will take any questions.
Linda, thank you. That was terrific update. We've been anxious to hear it. How about some questions or comments for Linda?
Mr. Dillinger.
I have a question about the 5-year-old. Why isn't that a mandatory report case? A 5-year-old that can't speak hardly?
Well, I'm guessing that's why the child was removed in the first place.
I missed that she had been removed.
The child had been removed and placed with a relative caregiver.
Okay, I missed that.
Is that relative caregiver participating in the program Kinship Services Network?
I know we've made the referral. I don't specifically, I mean, we make a lot of referrals. We have a lot of grandparents bringing kids in, and a lot of them are taking advantage of it. Some just aren't quite ready. And I don't know the situation of this particular case, but Mr. Dillinger, I do want to say also that one of the things that we've done recently, because we have had a number of foster care kids come through this committee, is connect Eckerd into this review. One child really, we thought the case manager for Eckerd needed to be stepping up and doing a little bit more. So we got them back involved, and it was very effective. So bringing in outside other partners when we need them.
Yeah, so if the child is removed, then Eckerd will assume the primary case management. If we brought kinship in, that's really duplication of efforts.
Right.
So once we would, the case would be closed out to jurisdiction of the court, then would be a time to engage kinship.
Understood.
So if I could, so there is coordination with the child welfare people. And can it involve court orders for the parents to get these kids to the mental health providers?
I don't know the answer to that, but we will certainly investigate it. We have only recently, the last couple of cases have been some foster care cases, have been connecting with Eckerd. But the nurse care coordinator is very involved in making all those connections happen. But I can follow up on that question. I don't know, Mr. McCabe.
This may be a good time to bring this up. The county got a $1.2 million grant, reinvestment grant from DCF that I'm the operator of in conjunction with Ready for Life. Now, this is aimed at children 14 and up, but it involves multiple therapists, multiple case managers, attorneys, to make sure that these children, it's called the Road to Success. So I know it's a little over the children that we're talking about here, but it is a referral. If these children are in the dependency system, we evaluate them and then we will provide them services until they're 21.
Wow.
So that should hopefully give you a good, smooth transition so that you know that that program's out there when these children age out of the children's mental health.
Well, right, and all that we're targeting ages 4 to 11, they're certainly treating all children that come through their doors that need some services. But in terms of data gathering, we're focusing on 4 to 11. Excuse me. But thank you for that information. We will add that to our toolkit.
It goes into effect September 28th.
Super.
I think, and I would add, I think in the near future, there's going to be and maybe Beth can help me with this, an overall look at the dependency system and what services are available that may not be coordinated right now. And trying to improve the child welfare system in Pinellas County and match up assets to needs and so forth. I don't know, Beth, if we want to go any further than that now, because we're just starting out.
It's pretty early, but I think you described it well. And I think our role, JWB's role, would be particularly on very focused on the prevention side. and tying in with what you've now approved in the strategic plan, in particular, connecting those kids who are not now connected to successful programs to those programs. And some of what you and I and Mr. Dillinger heard on a call, some of that relates to exactly that. So we have components of that discussion that we really already are somewhere on the path with. But I think it bears a much broader discussion, and we will come back and have that when we know more.
So I want to draw back based on this conversation to the refinement of design team work plans. I'm looking at the PowerPoint presentation, Linda, and one of the items is that cross-sector input, which is exactly the conversation has drifted there between the courts, Child Protective Services, and I was curious about how much of an involvement and engagement. It's one thing to be involved, but engaged by Pinellas County Schools, because that overlap of sectors to get underneath this issue of child mental health is going to be vital.
The school district couldn't be more at the table. I mean, and we wouldn't be this far without them. They are really, really fabulous, and they're at every call. But you can see that neurons firing on everybody. We're like, oh, well, we had that kid, and now the community health centers has added a field in their electronic medical record of school. Because at the beginning, the schools would say, well, what school does this child go to? And nobody, pediatricians don't normally ask that question. So now they're starting to routinely ask that question. And then the school staff can follow up if they heard that, well, they called the social worker and they didn't get a response, or, and they're making some adjustments to their workflows as well to make sure the communication goes back and forth.
Good. And I don't want to put Judge Moore on the spot, but something that was said, I'm not sure Bob or Bernie said it, a court-ordered placement. Judge Moore, do you have any comment on any of that?
You're muted, Pat. Patrice, you're muted.
The only time that we can court order any of these services is if Mr. McCabe's office has a dependency case open. Now, CPI can come in and they can make the family do voluntary services such as what is being offered, but a court order comes with a dependency case.
Right, but my question, I guess I didn't articulate it well enough. Can that be part of a case plan? That the parents get the kid to the mental health provider?
That is a part of the case plan. That's
right.
Normally the part of each case plan has if mental health is an issue, that they do the mental health and medical appointments upon reunification.
All right, that's what I was talking about. Thank you.
Power and benefit of all of us being together on this board. Any other comments from the board members? I can't thank the staff enough for this update. It's an important topic and one that I'm really glad JWB is a leader at the table. So thank you. All right. Oh, Beth knows this is my favorite topic coming up on this board agenda. So the presentation B, the Juvenile Welfare Board dashboard presentation. So I think it's Beth and Judith and Michael are going to address this topic, my favorite.
It is. Well, as you would guess, what that combination of people means is that I will present this, and then if you have any really deep questions, one of those other people will respond to the questions. So if I could ask April to share the screen and put the dashboard up, if she's able to do that. This is in your packet. It is a single page, which was my goal. And in terms of truly being a dashboard, the idea is that really with a single glance, you can get a sense of not every detail of every program or every area, but a pretty good idea, area by area, of how we're doing. We had to pick and choose. We certainly couldn't pick everything we measure, but we picked the things that have seemed to be most meaningful to you in our presentations through the year. And so most of these you have seen before as we presented each area. The first, the upper left-hand section is on financial performance. And it appeared to me that there were really two measures that a board member would want to know quickly to tell them whether our financial position and condition was as it should be. One is the percentage that administrative costs are of fund balance and expenditures, one that you look at every time you look at the budget. Your target has been that it not exceed 10%. And as you'll see, we have been, in that range of as low as 7.4% up through 8%. But we are well within that measure, and that's good. The second financial measure that goes to our financial health is the percentage of our fund balance of total expenditures. And our target has been 25%. And you can see through these, the first 3 years shown, we were well above that. This year, the current year appears to be lower, largely, I believe, due to the fact that we've not taken into account lapse, which you see in the other years. But as you can tell in the budget, in next year's budget, we would budget that target, us to well exceed that target. So both of these really tell you that our financial condition is where you would want it to be. Then we go through our 4 programmatic areas, and you have seen each of these. School readiness, we're looking at 2 different measures. The one is performance, being ready for kindergarten. The second is meeting VPK assessments. So these are, the first is in blue, the second is in orange. You will note that for any given year, there's a significant disparity. While Judith and others could give you a much better explanation than I could, what I would tell you is that one of the VPK assessment, which is the orange, which is higher, is a different tool, and the kindergarten readiness is done within the first month of kindergarten and requires a child to be somewhat conversant with technology, and many times they are not. And so we consistently see this difference between these 2 measurements of school readiness. The real point is, what are the trends and where do we want to be? We really want to see, at least 90% of kids truly ready for kindergarten. And I think what you see here is, depending on which measure you use, we're either pretty close or we've got a ways to go. And it's one we're going to continue to work on with certainly our understanding of the data with the school system, as we always do. But it goes to, as Mr. McCurrick talked about earlier, our commitment to the 0 to 3 population, which then rolls into the school readiness, the VPK population. So there is more that we can do. I think it tells you that given the one measurement, we're right where we'd like to be, but the other we're clearly not. School success, we're looking at the school testing, both in language and in math. And our target there is 45% of those kids will meet a prescribed level on the FSA. The kids that we serve in this portfolio are the most at risk, the most likely to not be where you would want them to be. And so 45% may seem like a pretty low goal, but in fact, for this population, it's not an unreasonable target. And what you can see over the last 3 years is some degree of improvement as we have looked at that academic achievement as one way of looking at school success for all of the programs that are in this bucket. And I would point out we are including in school success programs that we believe generally lead to school success, but in a specific way may not. Everything from dental sealants to school clinics, all important, but you might not see it on an individual participant basis and show up in the data. In strengthening community, we do a whole lot of things in this area, some of which are not as measurable as others. So the particular metric we chose to pull out was the number of meals that we are providing in the community to children. And that is across, certainly not just JWB, but the collective impact effort that JWB has been the backbone of. And you see that number, dipping a little bit in fiscal year 18 and then popping, then moving back up a bit in fiscal year 19. All of this, and I really should have said this from the beginning, the most recent full year data we have are our last fiscal year 19. We just simply don't receive that data more quickly than that. So one could say we're looking a little bit in the rearview mirror, but again, we're trying to look at the biggest picture and the most important trends. We've talked earlier and at other meetings about prevention of child abuse and neglect. And what this slide in the bottom right shows is that children who participate in or whose families participate in one of our programs have incredibly high odds of not touching the child welfare system again during the course of services or in the immediate time period afterwards. And that's what each of these bar graphs are showing. And you really see a pretty steady rate of high 90, not 100%, but high in the high 90s. It points out to us that those programs work and that they're effective interventions, which is important. It also then pushes us, as we are in the strategic plan, to say, how can we get more kids connected to those programs? So I'll stop at that point. There is a whole lot underneath this. There may be more questions that again, I will punt either to Judith or to Michael, depending on whether it's programmatic or more data oriented.
I got a question, Beth. On school readiness, on that slide.
Yes.
Percent of participants. Who are the participants? Is that VPK people that you're measuring, or something else?
Judith, you want to pipe in to make sure I give the right answer?
So for the blue line, Those are kids that are actually in kindergarten that are tested in the first 30 days. For the subsequent line that I believe is orange, those are kids that are actually in VPK. They're tested 3 times per year. What you see is their final testing results.
Okay, so the 50% people are not necessarily coming out of VPK?
A percentage of them are, yes.
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 Yes, they have to be our children that we serve.
Yeah.
Okay.
Correct.
Are they coming out of our programming?
Well, we provide the wrap services for VPK largely, so that they are a reflection of the programs that we serve with wrap. Do you want to add more to that?
Yeah, I guess what I would also say, Mr. McCabe, is that in general, what you see is the entire state and our county struggling in this particular test. The county-wide average for kids in that STARS assessment, which is the blue line, was 59%. And I think our kids are around 53, I believe. And if you are considering that we are serving the most at-risk children, then we are performing in line with the state and with the county. It still does not excuse the fact that we need to do better and perform better. And I know that Dr. Grego has a very high emphasis on raising performance in this specific metrics. I do want to caution everyone, we will feel the impact of COVID. We will.
I guess I don't understand. The blue line on school readiness, is that all kids going into kindergarten?
No, it is kids who have been in our program in the VPK, in a VPK program that we had the wrap services for.
Okay,
Correct.
that clears it up. I think we need to look at that and see what the curriculum is, because I suspect, and I'm not an education guy, that school readiness number significantly translates into the school success number down the bottom left.
Correct.
I mean, if you start behind, you're going to, a lot of times, stay behind.
Correct.
So it looks to me like that school readiness column needs to be looked at to see what the curriculum is, to make sure we're not just doing a lot of babysitting.
Right.
To be blunt, I
You are
guess.
absolutely right. And we don't have Dr. Grego here, but he could add a lot of depth to a response to that question.
So I just want to state that the curriculum that we do use is called Teaching Strategies Gold, and it is the premier curriculum. I think sometimes where we see struggles is at what point the child enters sort of the program that we're serving. So if they enter late in the programming, they're not getting the necessary dosage that they need to be successful. We also have children that enter the program with huge developmental delays. And although they're improving, they're still not meeting that mark, if you will, to be successful on the test. So there's a lot of nuances that are deeper into the data that are impacting that particular measure.
Well, if we give up and say we can't do better, we're going to get those same results.
Right.
Yeah, no, I'm not suggesting that at all. Yeah.
Right. And so I just want to clarify just a moment. If the participants meeting the VPK assessments are tested, if you will, at the end of the program, aren't we dealing with a little bit of summer learning loss if the testing readiness for kindergarten, I think I heard you say it happens in the first 3 months of school. So I think that's something that we need to factor in, that that's the beginning of that summer learning loss that we could be seeing with this data results.
Correct.
Well, it really doesn't matter what the reason is. If you continue doing if we continue doing what we were doing, we will continue to have the same result.
Right.
Yeah.
And
I
so-
agree with you 100%, Mr. McCabe. We have to do better.
Right. And it may be adding summer programming. Mike, I see your hand up.
Yeah, because I'm struggling through this a bit, and I'm online with what you just described helps. But what my concern is that if we're gaining, as we look, we have FY18, FY19, 88% have passed the VPK testing, yet some of those students, if not all those students, that's what I don't understand, have gone and, have moved from one to the other and have gone from the 93% became part of the 52% in 19. Is that correct? And if that's the case, then we've got something, I'm saying what Bernie's at, we've got some disconnect here. There could be multiple sets of explanation, but there's some disconnect between what was tested in the year before and how those students or those children are reacting in that following year in kindergarten. And that's a concern on my part.
Yeah.
Just to see what are we missing here? What's happening, whether it's a gap loss from a summer break or something. I mean, that's a huge disparate change, and that's that really concerns me.
Well,
So at this point, I am going to draw your attention to the time. It's a few minutes to 5. We begin our trim hearing at 5:15. So I am going to suggest that we bring this dashboard back to the next meeting, which is really only October 8th, and maybe do a little bit more underground work there, and come back in October 8th meeting and put this back on the agenda for discussion.
And I do want to say one other thing, Judith. I can see the Harvard studies that have now gone into your graft making and the use of messaging coming back to us. It's really good, by the way. But I saw that was when you provided me with some of the information from Harvard. These are the similar graphic looks of what they were providing. So I think it's it's definitely a great way to present.
If we're going to do that, can we put some statewide data on this? I mean, this is nice for Pinellas, but if we're way above the state average or way below it, I think that tells us something too.
There are a lot of things we could provide comparisons on, and as we drill down in each one of these areas, Mr. Dillinger, I think that's where we'll provide fuller comparisons. And
The only thing and I don't disagree with Bobby, whichever we think is the right answer, but I really I would want to stay away from getting too much information. We're focused on, and our role is to focus on what's going on in Pinellas County and make it the best it can be. And that's regardless of how well the state is doing or someone else is doing.
But they may have a better plan.
The best. And
I mean, I thought I heard school readiness statewide was 59%. I may have misunderstood that.
Correct.
If they're doing that without JWB's money and investment, maybe we ought to look at what they're doing.
Right.
I don't disagree with looking at it. I'm saying we got to mine is that we need to focus in on, because my fear is that, and we've talked about this in the past, is that when we hit a goal that everybody else has hit, we tend to take a deep breath and back off. And we should never do that. We should continue to drive forward.
So obviously this is generating much more conversation, and it deserves to be on the agenda for October. I also think, we need to go ahead and wrap up our meeting, but I also see this dashboard as a work in progress, because we'll have our 20 data, I hope, before too long. And then we'll be redesigning the dashboard for the next strategic plan with the input from the board, all of us. What is it that Mr. Dillinger wants and Mr. McCurrick wants, and what I'll be committing to that as well. So let's put it on the October agenda, recognizing that it's a work in progress. Today was the first debut, and I cannot thank you enough for getting the data simply stated in one page out for us to now pick it apart a little bit, ladies and Michael. So thank you. Beth, I've already had a conversation with you that we're going to pass on your CEO update, because so much of what you wanted to say was included in the agenda. Is there any request for public comment before we wind down this board meeting? Laura, can you check to see if anybody's looking to have comment on our board meeting?
Yes, I'm checking right now and just giving it a moment. And there is no request for public comment.
Okay, then I will ask our board members to put an eye on the information items. And if there's something you want to have further conversation. I would also remind our board members that September 29th at 5:15 is our second trim hearing.
You got muted.
Mhm.
There you go, Susan, you're back
There we
on.
go. I think Laura's trying to wind down and get ready for the next meeting. I just want to be sure that September 29th is on your calendar. We need that super majority quorum. And at this point, I think we have a moment to do the anniversaries for August, if you're ready. Unmute yourself first.
They have to unmute me. I'm unmuted, Laura.
You're unmuted. We can hear you.
You can hear me now? Okay, well, let's get on. It's August anniversaries and we're in a hurry. Judith Warren, 7 years. Yay. DeAndrea Dula, 6 years. Stephen Bailey, 4 years. Michael Havelka, 3 years. Joanne Wright, 3 years. And Patrick Pridgeon, 1 year. I have
You're getting really good at this, Rick.
I know. You want September's while I'm at it? We got time for September's? No?
Sure.
Okay. September anniversaries. Karen Boges, 15 years. Rebecca Alpert, 10 years. Paul Webb, 4 years. Desmond Newton, 4 years. Sabrina Egerton Malloy, for 2 years. Karen Streitman, 1 year. Jamie Peel, 1 year. There's a lady here with Beth Houghton, 1 year. Did I get that right? Close. And Naki Holloway, 1 year. And that's all there is.
Thank you so much. And congratulations, Beth, on your 1 year anniversary.
Susan, I just want to remind everybody that the next meeting is a separate link. So we will actually leave this meeting and then you'll click on the other link for the trim hearing.
Can you send that out again?
Does everyone need it or who was that, Mr. Dillinger?
Yeah. I'm
Okay.
just not sure how many links I've got floating around
I
here.
know it's a lot. I'll go ahead and send them all again as soon as I get off.
And we'll be signing back in at 5:15. And having said that, we can adjourn this meeting. Do I have a motion to adjourn, please?
So move.
All right.
Second.
We're ready to go. We'll see you at 5:15.
See you soon.